I'm Dr. William Craig. I'm the Director of Cardiopulmonary Rehabilitation Program here at the Cuero Regional Hospital. I've been a board-certified cardiologist for close to 40 years now. Heart disease is just as prevalent in women as it is in men. In fact, it's the leading cause of death both for men and women, and the percentage of women who die from heart disease throughout their lifetime is quite comparable to the number of men who die from heart disease. The only difference is it starts a little bit later in life. The symptoms can be a little bit more difficult to assess, and in some cases it's harder to treat because women have smaller hearts, smaller arteries, and so it's really important to diagnose this as early as you can in women to prevent bad outcomes. Well, particularly for somebody who's got a family history or risk factors like high blood pressure or cholesterol, it's very important to be aware of your symptoms. In women, the symptoms are not always as classic as we see in men. They can be much more subtle. We seldom see women we say pain, but in most people it's not pain, it's more subtle. It's heaviness, it's tightness, it's pressure. It may not even be that. It might be having trouble breathing. It might be sweating spells for no reason. It might just be unexplained exercise intolerance. But the main thing is to be aware and seek some evaluation if something changes that's new and different for you. The overall incidence of heart disease and the likelihood of dying from heart disease is no different for men than it is for women. In women, it's about a 23% chance of dying from heart disease throughout your lifetime. It's about 24% for men. So in this country, every 90 seconds there's a woman that dies from heart disease, sometimes because they didn't know they had heart disease. Sometimes the symptoms that women have, either as a warning of heart disease or as an actual heart attack itself, are not typical chest pains. They can be things that are often mistaken for other conditions. It can be some nausea, it can be indigestion type symptoms, tired or you get out of breath easier, but anything that's a change in your normal routine or normal symptoms, it's worth checking those out to see if it is or isn't a heart problem.